Hi, Sally Walker here, your hormone and slow age expert. So, what kind of complications can occur if we have too high blood sugar for too long? Chronic, uncontrolled high blood glucose, which easily can happen because we're not aware of the symptoms of when we have high blood glucose or blood sugar. So what are the problems? What are the disease states which can develop? So top of the list is heart disease, okay? So we can have coronary heart disease, we can have chest pains, angina, things like that, heart attacks, strokes, all this kind of thing. And one of the things which will be the underlying cause of this is the narrowing of the arteries, so the atherosclerosis. Because too much sugar in the blood can create inflammation in that endothelial wall, so the very inner wall of your blood vessels. And once you start getting inflammation there, you're going to get narrowing and you're going to have problems with blood supply to anywhere. And this could be your coronary artery, and so this could be giving you heart problems. But it's not only your heart vessels that can be affected by the narrowing, it's also the tiny blood vessels, sort of more in the extremities. So we can start getting numbness and pain in our toes, in our feet. And this can, if it's not resolved, can actually end with amputations. And this is one of the big results of type 2 diabetes, isn't it? Or even type 1 for that matter. So we need to do control our blood glucose. It's very, very important. We can also get nerve damage, yeah? We can also get problems with our kidneys, so the little vessels in the kidneys. We can also get problems with our eyesight. We get blocking of the little vessels in the eyes, so we go blind. Yeah, so the narrowing of the arteries can be quite a devastating problem. Now, gut dysfunction is also something which can be affected by high blood glucose levels and high glucose in the diet in general, the foods coming in there. So we can get an alteration in the absorption and elimination of the nutrients. We can get the gut bacteria will be affected by all the glucose, and this can also affect your skin. So we can start getting spots and acne and eczema and all things like this. So the gut can also be infected. And cancers, we know that cancer cells change the way the cell actually makes energy and really promotes glucose to make energy rather than burning fats. So yes, your cancers can grow if you have high blood glucose. So let's talk a little bit about sexual problems related to high blood glucose. So ladies, there could be the decreased blood flow because of the small blood vessels getting blocked or narrowed. We can get a decreased blood flow to the vagina and the vulva, and that means that there will be less sensitivity there. And also all the extra blood glucose can also affect the bacteria, and we suffer with thrush and other infections when we have a high blood glucose. And boys, well, I've talked about boys, haven't I? And when we did the testosterone one. So low testosterone is not necessarily the reason why you have erectile dysfunction, but narrowing of the little blood vessels is absolutely a major cause. So if there's no other reason at all, boys, you need to control your blood glucose so that you can have a long-lasting, very strong erection because you've got all the blood flow coming out to it. Yeah, anyway, check the article, check the other videos, and happy hormones, happy life.